Yes.
Dr. Bensianoff, tell us a little bit about dentures, because fixing a lots of implant, obviously does cost some money. And no matter what the ideal treatment is, money sometimes does play an option. And we do have dentures for people who, for some reason, like their gum disease, usually what it is, right? Gum disease, why you lose all teeth, usually, right?
That's most of the time the case.
Most of the time. I mean, very rarely is it some other inherited type of things or a big car accident or something like that. But on an average, it's gum disease, and over 1 to 5 to more years, you lost all your teeth, and they cannot be saved anymore. And you mentioned about, when you lose teeth, the bone the root in the bone makes the bone alive and grow, and when that root of the tooth is gone, the bone starts shrinking. So if you lose too many teeth, you start looking caved in, like a dried out tomato, look old. Some doctors tell me 5, 10, 20 years older if you don't take care of your bones in your mouth. Is that true?
Yes, that is the case. Whenever you have a denture sitting on top of the gum, it's just not sitting, it's because it's being supported by the gum, and the gum is, under the gum there's bone. So in other words, the dentures are sitting on top of the bone. And every time you eat, you exert the pressure on the bone, and what happens, you start losing bone. And it's a constant process. And the more you wear the dentures, the more chances of you losing a lot more bone. And that's where implants come in, where even you have your denture, which is supported by a couple of implants, you start losing a lot less bone versus.
Okay. So this is actually what I wanted to get at. So the people who where money does play kind of an option. So there is currently lately a way where you put dentures maybe with 2 or 3 or 4 implants only, which brings the price drastically down, but keeps your bone drastically more intact, because when you place that metal stick, that metal screw into the bone sinks, there's a tooth there, and doesn't shrink. It's almost like a natural way. And then you don't start looking old and caved in. And I think there are other advantages to having those type of dentures with implants supported also, in terms of biting, in terms of able to taste the food. Shed some light on that, please.
Oh, absolutely. Once the dentures are supported by implants, there's a lot less chances for these dentures to move around. And first of all, psychologically, patients are a lot more comfortable when they know that their dentures are not moving around. And then, when they're in public and where they're talking to somebody, they're not worried about the fact that the denture is going to come out of their mouth, and they won't be embarrassed. So definitely, for that reason, implants is a big plus. As well as chewing abilities. The forces of mastication, your chewing abilities increase drastically once the dentures are supported by implants. And you can definitely chew your food better, and you can taste your food better, because especially on the top, when we do a full denture, we completely cover the whole palate. So you cannot really taste the food as well as when you have your palate open. And therefore, when we do the implants, we can leave that palate open, so you can taste most of your food just the way you did before.
Beautiful, beautiful. And your bones don't shrink. You don't start looking like a dried out tomato, or like one of those, whatever you call those people who, anyway, ugly looking. Because so now, very obviously, a dentist just, basically became a competition to if done correctly. If people realize why they start looking ugly and maybe flat, in the nose, and they actually can avoid Botox by just keeping their teeth straight, correct, putting the implant in it, doing basically a dentist from inside out can be the best plastic surgeon to a very high degree. Because it just, if your bones cave in, you get wrinkles all over the place, you start caved in, and nobody wants that. And then they go and try to be doing cosmetic surgery, when really all they need is fix their teeth, or ideally, people listening to this, fix their first sign of gum disease so they never even lose their teeth.
Absolutely. And, dentures is the most conventional and the most old way to do that. But with implants, there's a lot bigger opportunity, and especially considering the fact that implants, if they're done correctly, are 95% successful, that indicates that this is a really good treatment option. Although it might be more expensive than regular dentures, but the benefits that you get out of it are they're a lot more than just money.
Right. And we really need to look, most of us do, we just sometimes forget about it, that it's the quality of life which we're after. You know what I mean? If we feel
Absolutely.
good, if we feel comfortable, if we, that's so much worth more than anything else. If you like good food and you can't taste it, you start losing something. I have noticed that the dentists tell me that sometimes when people put in dentures, even though they basically look good and from outside there's not much, a layman, maybe a dentist can see it right away, but normal people, you really don't notice it that much. But because the person has dentures, his self-confidence goes down. He now feels like he's old, he's over the hill, all kinds of things mentally start happening to that person, which just are not good for his overall lifestyle. Have you noticed that yourself?
I couldn't agree with you more. Not only aesthetically and psychologically, but functionally, when you can't chew a steak with dentures, it's impossible, or you can't bite into an apple, that affects the quality of life, as you just said. And, I couldn't agree more there, hopefully with the... Go ahead.
Can a person who has implant-supported dentures, 2, 3, or 4 implants and a denture, can he bite a steak and an apple?
Well, he could definitely do that if it's done correctly, yes.
Okay, so there's definitely big improvements, and it's kind of a hybrid, for lack of, for me, where it's a denture, a little bit more expensive, tremendously better, not yet a full set of implant, but quite hugely more functional.
Absolutely.
Beautiful. Thank you very much, Dr. Bensianoff.